this training is an introduction to some of the evidence-based models that fit very closely with what we already do. Right now there's a lot of changes in the NHS, which means that we need to reconsider what the most effective forms of practice are without psychotherapies. So it is an introduction to sort of really give people the basis of effective models in mental health, the ones which are core. This is a foothold in evidence-based practice. Because of our strengths, both in terms of engagement and treatment, from acute into community services, we're in a very good position to build on that. We're very recognised. We're still a relatively small profession, and so it's not feasible for us to be available to every area that's needed. However, what we can do is really demonstrate that we're extremely effective, and that CNWL NHS Foundation Trust has been extremely supportive.
It is most unlikely that the next development in the treatment of mental disorder will come from psychopharmacology. If there are going to be developments, it has to come from the psychological therapies. Because there is this, to my mind, overlap between what is most human in what you guys represent as art therapists and what is most human to me about any kind of mental disorder. That these two domains coming together in a therapeutic endeavour informed by science is going to be the next step change in the psychological treatment of mental disorder.
So that when he comes back to him, he then feels it taken over, overwhelmed by the tsunami that's flooding all the way through him and destroying him and everything else in the world, everybody else in the world. But you're also saying it could be a relief. And, you know, this picture of the lion, is this one of those sort of images of being overwhelmed? It seemed, and he said about it, it's very important to get the boundaries of the eyes and so on, as if this is not just an image of rampant, uncontrollable destructiveness, but as if this could represent something that shows it to be a little bit more manageable.
Mentalisation-based treatment has been modified, simply integrating the arts mediums that we use to help facilitate change particularly for borderline personality disorder patients.
And to promote dementalising about oneself, about others, and about relationships is always, not always and only, but certainly the focus would be within the interpersonal context.
Getting a balance between holding the affect of the patient or the family or the relationships, but also holding the cognitions and probing to find out more about what's going on. Because that's quite a different stance, I think, for many of us. I don't know if I'm alone in thinking that, but it certainly was a bit of a shift for me and a bit of a change.
And lastly, interpersonal already has a significant evidence base. So all three areas are informing our practice. IPT, which works specifically for depression, some eating disorders, is a relatively short-term, relatively brief therapy. So it means that really we can still do very effective work, but in less time. But with the new GP consortia, I think they want to know that whatever's happening is linked in with the NICE guidelines. And so some of the guidelines are quite open. and some are much more specific. So, for example, working with borderline personality disorder patients, the guideline is quite open. However, it specifically says mentalised-based approaches are effective. This is what we would recommend. This is one recommendation. So commissioners want to know that we're doing that, that we're applying these models in the right way at the right time on someone's care pathway.